Hey guys, Dr. D here. Last part of our little series on the back, we're going to talk about the support infrastructure. Learning objectives here, basically that's it. Tell me what supports the intrinsic and extrinsic muscles of the back. And I've got a little way that I'm going to show you how to make that happen. One thing I want to talk about is please don't focus on minutia. Boards, and for that matter, when you get in rotations, they focus on the big things. So when you see something big and obvious, that is what we want you to remember, not the things that you're only going to see one time on one line, okay? And if you think I'm talking to you, I probably am. All right, here's my little MSK acronym, all right? It's Navy, nerve, artery, vein, and lymphatics. Basically, the artery is going to get whatever you're burning to the point to where it's going to burn. The nerves help burn it, and you're going to get an action. You're either going to get a muscle or a brain function activity plus trash. And then the veins and the lymph, that's their job, is to take out the trash. They take out different parts of the trash, and they do it different ways. So remember Navy when we're talking about any MSK structures, and that's going to help you stay on track. It's almost impossible to separate the discussion on the nerve, artery, veins, and lymphatics from whatever structure you're studying. And here we have the back and shoulder and the upper extremity. Illustration here is to represent that, even if we take the muscles out of the way, there's a network, a highway that helps make things happen. The nerves, again, cause things to fire up. Arteries take whatever nutrients are being burned there, and they have their own channels and notches. When we get to the extremities, we'll talk about those individually. Same thing for the veins and lymph. They often travel together. And when we start having problems with MSK, when these particular structures get loss of their normal function, that's when we start to have some fun on the clinical side. Innervation of the back, we got three primary groupings. We have the nerves at the top, we have the intercostals and subcostals in the middle. You see the word costals, that tells you ribs, right? And the anterior rami and the posterior rami that run up and down the spine. Anterior rami are going to be primarily responsible for the extrinsic muscles innervation. Here's a nice little chart. And then when we move to the intrinsic muscles or the deep muscles of the back, that primarily is going to be innervated by the posterior rami. Remember, big things, not minutia, big things. Arterial supply to the back is not a huge boards level question. The branches come off of the aorta. They run to the back through the posterior dorsal intercostals. Again, see the word ribs. You have the ones on the top and the ones on the bottom. Here's a nice chart. If you notice, you see the branches for the posterior intercostals. They're in a whole bunch of boxes, right? And I want you to pay attention again to the big things, not the little things. Don't want to ignore the minutia, but I've kind of clustered these together for you. The ones that come out of the cervical spine are in orange. The next down is going to be in the shoulders. It's going to be yellow. Around the ribs is going to be in blue. Pink is going to be the lumbars. And then you've got the sacral stuff that's going to be kind of in that green color. So again, please just pay attention to the large groupings. No minutia is going to show up on either my test or on the boards. So a little exception to that minutia rule is the dorsal scapular artery. It runs along the medial border of the scapula. And if there's a problem with this artery, then you're going to have problems with motion in the shoulder. So the traps, rhomboids, and lats are affected. And that's definitely a clinical challenge that we're going to address once we get to that shoulder. All right, venous drainage, let's look at this from the big picture. There's stuff in the front, there's stuff in the back, there's stuff up high, and there's stuff down low. Primarily on the anterior aspect, we're talking about from the belly button to the spine, right? So the first veins from front to back are the external spinal, next are going to be the internal spinal, then the radicular, and then just the spinal. And know there's cervical, thoracic, lumbar, and sacral segments of each one of those. All right, then we're going to move around onto the backside. We're going to talk posterior. So on the posterior, same thing, reverse order. Closest to the spine, spinal. Next farthest away, radicular. That's a network. Then the internal vertebral, and then the external vertebral. Also cervical, thoracic, lumbar, and sacral branches of each and every one of those. Not hugely testable material, and know that the spine is the center focus point going to the front and going to the back, and then again from cervical, thoracic, lumbar, and sacral segments. And then we have the Y in Navy, or the lymphatics. Lymphatics pretty much run in parallel with the venous drainage, go through some of the same notches, and we'll go through those when we get specifically into the joints. It's broken down into some watersheds, if you will, so it drains into specific areas. In the upper back, you've got the sagittal and upper horizontal. They drain into the posterior axilla. Lower down, lower thoracic, and into the lumbar spine is the horizontal watershed, and then in the low back, you're going to have the gluteal watershed. All right, so that's our Navy. Our learning objective, we've gone through all the support structures, right? Extrinsic and intrinsic muscles. And then here's a cumulative chart that I've showed you as we've gone through this review. Let me break it down a little bit for you again. So this chart primarily just covers the innervation and arterial supply. Start at the top, the extrinsic muscles. Anterior rami are the primary innervation for those extrinsic muscles. Of course, up higher, you're going to have the accessory, and then going into that shoulder blade, right? Thoracodorsal and dorsal scapular. Intrinsic muscles at the back, hey, look at that big box. Posterior rami are going to be the primary innervation for the intrinsic muscles. And of course, you've got some little bit of part that's covered by the anterior rami, but again, only pay attention to the big things, right? Arterial supply, look at how many boxes have branches of the posterior intercostal. Doesn't matter if it's lower, doesn't matter if it's upper, just know that the primary blood supply to the entire back is going to be those branches of the posterior intercostal. Now, when we look at the specifics, you see the column in between there, I put coli and capitis in orange. So all of your orange blood supplies on the far right are going to be for the capitis and the coli muscles. The blue ones, see that, thoracic, and you're going to see all the blue ones, subcostals, pretty much are going to be getting you covered there. Got some pink boxes there. You see the L in the middle, that's of course lumbars, right? And then you see the lumbar arterial supply also in pink on the right. And I didn't put sacrum, there's no muscles that specifically go down there, but you see the lateral sacral, all those green boxes all the way down there at the bottom aspect of the blood supply. And I did forget, you see those yellow boxes? Remember we talked about that one specific dorsal scapula that goes to the scapula, and thoracodorsal is there too. So the yellow is the ones that probably everything to the right are the ones you're going to want to pay attention to out of that whole chart on the right-hand side. All right, here's my infamous blackout study guide, right? Stuff not blacked out, probably a good idea to know. Stuff blacked out, for goodness sake, don't drive yourself crazy trying to memorize all that stuff. All right, guys, it's been Dr. Doherty. That's it for the back. We'll see you probably in the upper extremity next time. Take care.